Good afternoon. My name is Nicole Harris, and I want to talk to you a little bit about the research I've been doing over this last semester and kind of over my whole time in the EDD program. But this semester specifically, I was looking at simulation labs' impact on physical dysfunction fieldwork preparedness. And unless you're in the medical field, some of these terms probably don't make a whole lot of sense, but I will describe what each part of this is first before we get into the actual research. Looking at my need, I wanted to look, well, first, simulation labs have been used increasingly to help assist in developing skills in the healthcare education program. What simulation labs are, and I'll talk about this more on the next slide, but it's simply put, it's just a mock environment of healthcare rooms used to teach students the skills that they'll be needing later on to work with patients in real life settings. While many programs have been using them, especially nursing, PT, EMT, physician, OT education is still kind of behind in using simulation as an educational tool. And that's where I currently teach, is for the University of North Dakota's occupational therapy program, and that's why I wanted to specifically look at this. So the purpose overall of my study was to determine whether or not second-year students in the occupational therapy program at the University of North Dakota felt like their simulation experiences during the first year of their program played a role in preparing them for their level 1 fieldworks during their physical dysfunction rotations. So to kind of expand on these terms and make them make a little more sense, what simulation labs are is an opportunity for students to engage in experiential learning that provides real-life healthcare experiences in mock environments. Students get to practice these skills in settings that appear real, but are in a low-stakes environment. And what this means is, even though if they're receiving a grade on it, or they know their professors are watching them, they still can't hurt a real person. So there's very different types of simulation that are used. There's what's called high fidelity and low fidelity. And low fidelity is what's been used in healthcare for a long time. So this would include like case studies, role playing in the classroom, things like that. The other type is high fidelity, and this is kind of what my focus is more looking at. So high fidelity is using either trained actors to act like patients, and trained actors could mean, just like other students, people in the community, things like that. But what more common is used now is what's called high fidelity mannequins. So there's these mannequins, they can be in hospital setting type rooms, they can be in community setting, home setting, but these mannequins are run by computers, and they can simulate breathing, they blink, they can talk, usually someone's on the other end of the recorder talking for them, but you can set them to respond to, actual physical interventions. So you can have them set to have a high blood pressure. So if a student's taking a blood pressure, you can determine if they were accurately able to get an appropriate reading. Or if, say for a nursing student, if they injected a specific kind of medication, it would have a real physiological response to that. Then there is the debriefing, and this happens after simulations occur, the high fidelity simulations. So what generally happens, and I'll just give you an example of what we do currently in our program, is the students go in, it's a hospital room, so they have either a mannequin or someone playing the role of a patient. They go in, they have the history and physical before they go in, so they kind of know what they're expecting, and then the person will act out a scenario, and the students have to provide appropriate interventions to this person. There's a one-way glass or mirror in there, so that what I do is I sit on the other side and I either play the mannequin if there is a role for that, or I just watch the students and how they engage. Then afterwards, we get together, and usually, like what we did in our last time was 2 students go in the room, and then 4 students watch the other 2 students. Then we all come together and we do what's known as debriefing. And this is just a guided reflection. So you kind of encourage the students to lead it themselves, talking about what went well, what they would do different next time, maybe what they missed. And then also, as the instructor, you provide feedback, and then the other students that were watching them also provide feedback. A lot of the research on debriefing for the simulation labs actually talks about how some believe that the debriefing is even more important than the actual hands-on experience, just because, again, it's a little more low stakes. But one thing I always do during the debriefing is I always make sure to ask the students, what's one thing you know you'll never do again after, if there was some kind of mistake in there. And usually what I found the students to say is, things like, I'll never forget to wash my hands again before going in, or I'll never forget to introduce myself, or if there was someone that played a parent in the room, I'll never forget to, introduce myself to them or acknowledge that they're in the room, or I'll never forget to, talk to the person as if they, truly understand what's going on. So a lot of good things coming out of the debriefing part. Oops, sorry about that. Okay, so the next part, talked about the simulation labs a little bit. The next part I want to talk about is the physical dysfunction fieldwork. And this is what OT students go out on. This is like their rotations, or, what different people do, healthcare professionals do right before they get ready to graduate. So the OT students in our program, before they go out into field or into practice, they have 5 level 1 fieldworks during the program, and then they have, which are all 1 week, and then they have 2 level 2 fieldworks, and these are all 12-week rotations. The level 1s, they do 1 in a pediatric setting, 2 in psychiatric settings, and 2 in physical dysfunction settings. And then with the level 2s, they do 1 in a psychiatric setting and 1 in a physical dysfunction setting. So this is stuff like orthopedic injuries, things like that. I looked at physical dysfunction this semester just because that was a semester my students are in the program, and that's who I had access to gaining information from. So to prepare for this, I did a literature review. I found the benefits of simulation labs for clinical reasoning and application of skills. I found that there was limited information for the use of simulations in OT educational settings. And then I also found there's very limited studies linking the use of simulation labs and preparing these OT students for fieldworks, which ultimately prepares them for practice. My sample size, because our OT program with the University of North Dakota has 2 locations, we have students on the actual Grand Forks campus, and then we have students in Casper, Wyoming. So I had access to all year 2 students in their physical dysfunction coursework. So there were 17 students from Casper and 20 students from Grand Forks, and they were all in their second semester of OT school. And just kind of a side note, our year's a 3-year program, so it was right in the middle. I developed a survey. The survey had 15 questions total. There were a few demographic questions looking at which campus they were on. There was one looking at what year they were in school, and then also looking at the specific, narrowing it down a little bit to where they had done rotations at, where they planned to practice in the future. So some of those looked at like, was it an inpatient? Was it outpatient? Was it community-based? Was it in a skilled nursing facility? And then the main focus was on the occupational therapy process, looking at their skills establishing rapport with patients, utilizing standard precautions, so that's like cleaning hands, using gloves, completing evaluations, actually implementing OT interventions, looking at the discharge process, and then their overall comfort level for practice. So results. This first one was not surprising at all. I asked students on both campus, or all the students in the sample, how they felt about the number of simulations in the program, and 100% from both sites said there's not enough simulations in our program. We currently only do 2, and they only occur during their first year of the program. The second set of results was how they felt the simulation process helped with different aspects of the OT process. As you can see from the table here, 1 was very effective all the way down to 5, which was very ineffective. And then 6 was no impact, and 7, they didn't have a chance to practice. So looking at these scores, they were kind of all over the board, looking at the minimum and maximum. But you can see with the standard precautions, that's where we had closest to 1, which was very effective. This isn't surprising because one of the 2 simulations that we do is all about standard precautions. The lowest one was preparing for discharge, and that again didn't surprise me just because none of our simulations are geared around discharging patients. Some results with the overall comfort level. This is based on what type of setting they were in on their 1-week fieldwork. This one surprised me a bit. I expected acute care to be the highest just because the simulations we did were in a mock acute care settings, but actually they said community settings had the most highest mean for comfort level. So conclusions I came to: second year students would like to see more simulation labs in the UND OT program. Simulation experiences need to be more specifically designed to reflect the OT process, and simulation experiences need to reflect a better variety of settings. Some limitations that I found: I only had access to 1 cohort of students, so I couldn't see how different years of students viewed this. Time was an issue. This survey went out before their first level 1 in physical dysfunction, so results might have changed after they went on their second one, and none of the students had level 2's experiences before this either. What I plan to do with this is I would like to survey students again after their physical dysfunction level 2 fieldworks to see if there's any change after they were out on 12-week rotations instead of 1. And then also I have got an okay by my dissertation committee that I am going to use this as a dissertation project instead of doing research. What I'm going to be doing is actually designing simulations to go in UND's new curriculum, OT curriculum, because next year we're transitioning from a master's program to a doctorate program. So I'm pretty excited to be able to work with the curriculum committee on all of this and kind of take a lead in getting a lot more of these simulations into our program. If you have any questions about this research or what I plan to do for my dissertation, here is my contact information, my office number, and then my office email. Thank you.